광고. My name is Seoree. Okay. Today I show my last year's presentation. I'll give you the presentation of the format of our hospital's formal format. Okay. You all have to do English presentation on the third grade of PK life. So maybe all of you maybe write this format, use like this format. Okay.
This year.
Okay, after 2 years.
One small baby. Today my topic is IUGR, Intra Uterine Growth Restriction. Okay.
What is it? Explain that.
네. Okay. Intra-uterine growth restriction is defined as the growth of the fetus is abnormally slow. After the birth, the baby appears smaller than the predicted size, and that the small baby was too small to live by themselves. Do you understand? Okay. Let me take my case presentation in OBGY class. This 41 years old female who was admitted on March 9th. Due to detect the worsening of IUGR confirmed by phono. This 41 years old patient who had gestational hypertension was admitted for further evaluation and measurement of IUGR and mild preeclampsia. Preeclampsia. Jiyeon, do you know preeclampsia? Yeah.
Whoa.
임신 중독증. It means a pregnant woman who have hypertension, uremia, and pitting edema, and it is severe symptom. So it is one of the cause of the fetal growth restriction. Because it is to
blood supply is restricted because of the mother's hypertension, so the fetus cannot grow well.
Ooh. Okay. In her OBGY case story, was like this. She had previously explored laparoscopy, left vertical oophorectomy state, and she had gestational hypertension confirmed by an internal IUP at 30.5 gestational week. So she takes the calcium channel blocker. In the review of system, she had occasionally headache, but there are no other discomfort. On her physical examination, she had mild hypertension and she had trace pitting edema, one positive trace pitting edema.
Sorry. Yeah. Is why she explained visual disturbance, upper abdominal pain, and GI discomfort. Those are common symptoms of preeclampsia.
This is the lab result on March 9th. All the results were within the normal range except for the urine protein. It showed the one positive value. Her leakage and the chest X-ray was normal. And okay. From now on, we will show from ultrasonography and Doppler image. The serial Doppler image means the serial Doppler image shows the worsening of intrauterine growth restriction because her baby was threatened by the low blood flow. Okay. Here is her NST. Her fetal heart rate variability was moderate, and almost it shows the no constriction. So, based on her history and the lab result, we based on the impression of this case with intrauterine pregnancy at 44 plus 1 gestational week, IUGR, and mild preeclampsia. So we decided to deliver her baby, but her baby was breech presentation. It means fetal head was low position. So we could conduct it by cesarean section. Okay.
Breech means hip. So the fetal hip is positioned on the lower line, maybe cervix, near cervix.
Operation record. Her baby was male and the birth weight was 1.4 kilogram. And her baby's APGAR score, the 1 minute APGAR score was 5 point and the 5 minute APGAR score was 7 point. APGAR score, do you know APGAR? Okay, Sumon, do you know APGAR score?
Hoyoung knows.
Yeah, could you explain the APGAR score?
APGAR score expresses the possibility of baby's survival.
Yeah.
At 1 minute after birth and 5 minutes after birth.
They appraise according to the baby's skin and the muscle strength and what is it, respiratory rate and heart rate. And
So what is the 5 and 7%?
no. It's
Score out of
max
10?
score is 10
Oh, okay.
and
Out of 10.
0 is the lowest point.
Okay.
Usually most babies they get 8 to 10 APGAR score. The baby was in IUGR, intrauterine retardation restriction. So that's why he or she he got lower APGAR score. So according to APGAR score, the pediatrician practice additional support management.
Okay. From now on, we will show some progress. On post-operative day 1, her vital sign was stable. Her blood pressure was a little bit high, and she shows the urine protein 1 positive value, and she had a trace peaking edema 1 positive value. So we plan to check the vital sign routinely, and recommended her early ambulation.
I have one question. What's the meaning of the pitting edema? What is the pitting?
Peaking edema is
Actually, it reflects how much we have water in our body. So if we have too much water in our body, it can be showed in the presentation of pitting edema. That means
TV, anterior TB야.
yeah,
푸팅도 anterior TB.
if we push this part, there usually it goes up. How can I say?
Goes-
다시 올라온다.
The skin?
Yeah, the
Yeah.
skin.
Ah, okay.
But if people shows pitting edema, it does not go up. 눌린 상태로 그대로 있다.
dimple.
In print,
Yeah,
Yeah.
yeah, in
doesn't
prison.
come back?
Yeah, it doesn't come back. That's right.
Because of a lot of water.
Because the water retention,
And
that's
unbalanced.
water retention
Yeah.
evidence.
So pitting edema means water retention.
Yeah, yeah, edematous feature.
Yeah.
Usually most pregnant women, they show pitting edema. That's one of the common symptoms of even in normal pregnancy. But actually she has
Preeclampsia.
yeah, she had preeclampsia. Maybe it might have been severe more than.
Okay. On her post-operative day 2, she complained abdominal pain and her vital sign was stable, and she did not show the urine protein any longer, and she could start bleeding. So Eclampsia checked the vital sign routinely and observed the wound site, and the other is stable condition. Okay, from now on, from now on, I take the case with you about the fetal growth restriction. It means IUGR. The fetal growth restriction is defined as the weight below the 10th percentile for their gestational age. As the birth weight percentile falls, the mortality and the morbidity rate increases. There are two types of fetal growth restriction. One of the symmetric growth restriction, and the other is the asymmetric growth restriction. The symmetric growth restriction was caused by chemical exposure, viral infection, and many other causes. However, asymmetric growth restriction, it is caused by placental insufficiency from hypertension. This is one of the preeclampsia, and breast scarring. Okay, there are many other causes.
Okay, symmetrical growth restriction. In that case, all parts of the baby is small. So head is small and extremities are small. In the case of asymmetrical growth restriction, the brain size is usually normal and the trunk or extremities are usually small. So in asymmetrical growth restriction after birth, the babies they tend to catch up growth. Maybe they get the chance to be almost the same with other normal babies. But in symmetrical growth restriction, they are usually they don't reach the normal size even after birth, like Down syndrome and many other.
Okay. This table shows the risk factor of the fetal growth restriction, such as constitutional small bladder and placenta and cord abnormality, poor maternal nutrition, and so on. Our case was including the placenta and cord abnormality. to identify the fetal growth restriction, we can use uterine fundal height and sonography, amniotic fluid measurement, and Doppler velocimetry. To prevent the fetal growth restriction, it begins with removing the risk factor. For the prevention of fetal growth restriction, ideal begin pre-conceptually with optimization of maternal medical condition, medication, and nutrition. Okay.
Preconception means before pregnancy.
Yeah. Once the fetal growth restriction was suspicious, we have to confirm the diagnosis and assess the fetal condition and evaluate for other anomalies. If the fetal growth restriction diagnosis was to near term, then we should prompt delivery. It's the best choice. And if we find the growth restriction was remote from the term, then we recommend the close observation. Did not prompt delivery. So this is the final last slide. The low birth weight, the IUGR were associated with the adult hypertension and atherosclerosis, and it was associated with the IUGR was associated with type 2 diabetes and the ischemic heart disease. Which do you know atherosclerosis?
Atherosclerosis? Like, I've heard the term, but I don't know, I can't remember. What does it mean?
It means the occluding our blood vessel with fat and other dust material. And ischemic heart disease is